Hey, it's going. Hi, my name is Hunter, and today I will be performing oxygen administration. I'm wearing my school badge. I've got school appropriate scrubs on. I've got my face here, my nasal cannula, and then my non-rebreather mask. My non-breather mask, sorry. Yeah, my non-rebreather mask. I apologize. As noted, I know that in the video we were supposed to have our supplies in the packaging, but my bag kind of really broke open on this one, so I just wanted to note that. But ideally, in a real life situation, it would be sealed, closed, doesn't have any damage. But yeah, so in addition to that, we would need our hand sanitizer here. So we'll go ahead and get started on the skill. So I would knock on the patient's room, enter the patient's room, close the door behind me to ensure patient privacy, perform my hand hygiene, okay, introduce myself to the patient. Hi, Mr. Smith, I'm Hunter. Can I get your full name and your date of birth? Verifying it to their armband. Okay, great. All right, so we've noticed that your oxygen levels are not quite where we would like to see them. So we're gonna go ahead and give you some supplemental oxygen today. Will that be okay? Okay, great. So we'll go ahead and get started with the nasal cannula first. And then it's important to note that before we, administer oxygen or supplemental oxygen, we want to, one, do a respiratory assessment, check an ABG if necessary, and then also, using a pulse oximeter to assess their oxygen levels. But at this point, the order has already been, ordered. The provider has already put that order in, and we are just demonstrating the skill. So we'll go ahead and get started with the nasal cannula. So with the nasal cannula, you want to explain it to the patient while we're doing it. Okay, so I'm going to go ahead and get you, this is a nasal cannula. We're going to put these prongs, one of each is going to go into your nostrils, and the other, and then it's going to wrap around your ear, come around your neck, kind of hang here and sit here. Okay, does that sound okay? Okay, so we'll go ahead and we will plug the extension tubing, or this will go into an extension tubing, and then we would set the flow meter at an appropriate flow rate as what the order has said. So generally for a nasal cannula, it's going to be between 1 and 6 liters. But again, we always want to administer what the order is, telling us. So when we connect the tubing, we also want to check that it's the green oxygen. It's going to verify that we have, properly put it into the correct supplemental oxygen. So we'll go ahead and put this on the patient. All right, so we're going to go into the nares there, over the ears, come down around in front of the neck, and then make sure it's securely, gently secured. Okay, great. A little bit of education. So with that, we want to make sure it's not too tight, but it's secured. You may experience some skin irritation, but if it's too tight, you certainly will. But we want to just keep an eye out for any skin irritation that you may experience or breakdown. Okay, so after that, I would maybe leave the room, come back in. All right, Mr. Smith, we've noticed that your oxygen is not quite where we would like to see. The provider has ordered us to try out a different mask. So we're going to go ahead and get this removed and put this new mask on you. This is a non-rebreather mask. Right. Okay, and this one is going to sit on your nose here. Okay, gently. It'll cover your nose, come down around your mouth, and kind of hang on your chin there, okay? And it will wrap around the back of your head. Do you have any questions regarding that? No? Okay, great. So we will go ahead and get this mask out and set up. Okay, so also important important to note that when we remove and disconnect this nasal cannula, we want to immediately connect this one. Okay, and again, checking or setting the flow rate and making sure that we have properly connected to, green oxygen. Okay, so we'll go ahead and get this removed. Okay, alrighty, get that removed for you. Okay. Okay, then we'll go ahead and get this one connected. Set the flow rate as the prescriber has ordered. Can't quite get it. Oh my goodness. Sorry about that. I just want to make sure it stays, but I think we're good. Okay. So I'm going to go ahead and apply this starting at the nasal bridge. Okay. All right. Okay. And when we set this one, of course, we want to set it to, the prescribed order, or what the provider has prescribed. But ideally, in order to keep this inflated, we want to keep it at least 15 mLs. Okay. So I went ahead and applied this in the mouth. Right, and then the oxygen bag or the reservoir bag is just going to sit here on your chest, okay? Do you have any questions? Does that feel okay? All right, great. So we will go ahead and make sure the patient's comfortable, ask them if they have, or ask them if they're comfortable, make sure they're okay. Okay. So then at this point, I might leave the room, but I did want to kind of move into the next portion where I want to explain the purpose of using gauze for padding. When a patient has oxygen therapy or they're on supplemental oxygen, they have a mask, there is a risk of the patient developing skin breakdown or irritation due to them having it on for a long period of time. And a couple of places that we could place padding or gauze to kind of prevent that irritation is on top of the ear, behind the ears, depending on what type of mask they're using there, right? And then down on the cheeks, because you may experience it there. And then in addition to that, also on the nasal bridge there. Okay, all right. Okay, and then I would step out of the room if necessary, or whatever that situation might be. Come back in, let the patient know, all right, Mr. Smith, your oxygen levels are back up in the optimal range. We're going to go ahead and get this removed, okay? All right. Okay. Okay. And then dispose of both the non-breather mask and the nasal cannula. Okay, so that is done. Excuse me, as far as the skill portion goes, but a couple things to note. I can't remember if I noted on the nasal cannula when we set that flow rate. Of course, we want to make sure that we set it to what the prescriber, excuse me, has ordered, but ideally between 1 and 6 liters is going to be more ideal, or is going to be in that range of appropriate for a nasal cannula. And then if it's over, if it's over 4 liters, we want to make sure that we're using a humidifier. But if it's less than 4, sorry, I'm trying to remember here. If it's less than 4 liters, we don't need to use one, okay? And then when a patient is on supplemental oxygen, they have a mask on, or, the nasal cannula, whatever it might be, we always want to check the patient every 2 hours for any kind of skin breakdown or skin irritation. And then just if a patient is on oxygen, we want to just make sure that it's at the appropriate flow rate and check on the patient every hour. So that is it. And then, sorry, I started talking, then I forgot. But ideally, after I remove the mask, I would perform my hand hygiene. Then I would exit the patient's room and document the procedure.